रुक के नहीं आ रहा था।
A very good morning to all present online and offline. I welcome you all. I heartily welcome our MS sir, Dr. C.M. Singh sir, Associate Dean Dr. Ruchi ma'am, Speaker Dr. C.M. Kamal sir, Dr. Rani Indra ma'am, Dr. Lalit Mohan sir, and Dr. Nitesh Mishra sir, our faculty, residents and participants. I welcome you all to this test lecture on assessment of postgraduate MD Pharmacology as per recent guidelines of CBME curriculum. Competency-based medical education, that is CBME, has been introduced from Medical Council of India to transform the existing traditional teaching learning process into more student-centric, need-based and community-oriented. New CBME was implemented nationwide in the first phase of the MBBS in 2019, and it has been received and implemented with full enthusiasm. With this, I request MS Sir Dr. C.M. Singh sir to come on the dais. Now I request Dr. Pramod sir to present our gratitude in the form of sapling to our MS sir. I request Associate Dean Dr. Ruchi ma'am to come on the dais. Now I request Dr. Shruti ma'am to present our gratitude in the form of sapling to Dr. Ruchi ma'am. I request the Speaker Dr. C.M. Kamal sir to come on the dais. Now I request Dr. Sunil sir to come to present our gratitude in the form of sapling to C.M. Kamal sir. I request Dr. Rani Indra ma'am to come on the dais. Now I request Dr. Shruti ma'am to present our gratitude in the form of sapling to Rani Indra ma'am. I request Dr. Lalit Mohan sir to come on the dais. Now I request Dr. Vikas Maharshi sir to present our gratitude to Lalit Mohan sir. I request Dr. Hitesh Mishra sir to come on the dais. Now I request Dr. Rajesh sir to present our gratitude to Hitesh Mishra sir. With this, I would like to request Ruchi ma'am to say a few words.
Very good morning to everyone, and good morning Dr. Kamal, and good morning Rani ma'am, and CMC sir, and Dr. Mohan. I congratulate Dr. Pramod Kanji and the Department of Pharmacology for arranging this talk. And I feel this is a very relevant topic in today's world when we are dealing with there is a buzzword of competency-based medical education, and a very important aspect which will be covered today is the assessment. And I wish all the best for the today's talk. Thank you.
Thank you, ma'am, for your valuable speech. Now I'd like to request MS sir, Dr. CM Singh sir to say a few words.
Thank you. At the outset, I would like to welcome you all at the All-India Institute of Medical Sciences, Patna. And today we are going to listen a very good lecture, basically, by a renowned speaker, Professor C.M. Kamal. And this lecture will be on assessment of postgraduate in Department of Pharmacology, how to assess the postgraduate students. This will be very important to particularly to postgraduate students and faculty also. So I congratulate Department of Pharmacology for organizing the events, and I congratulate also and thanks in fact to Association of Pharmacology and Therapeutics for giving the opportunity and providing the opportunity for holding this lecture. Thank you everyone.
Thank you, sir. Now I request Associate Dean Dr. Ruchi ma'am and MS sir Dr. CM Singh sir to kindly take their respective seats, and I request Dr. CM Kamal sir, Dr. Ranindra ma'am, Dr. Lalit Mohan sir, Dr. Hitesh Mishra sir to remain on the stage so that we can start the session. Now I request our HOD sir to give the welcome address and formally start the session.
Thank you, Dr. Nisi. Honorable guest speaker, Professor Dr. C.M. Kamal sir, Professor Dr. Rani Indra Sinha, respected MS sir, Professor Dr. C.M. Singh sir, Associate Dean Academy, Professor Dr. Ruchi Sinha ma'am, distinguished faculty of the department, my faculty colleagues, all senior residents and junior residents and other staff. A very good morning and a warm welcome to all of you. So, assessment drives learning. So, assessment is very crucial in teaching learning process. Today we are together here to discuss about assessment of postgraduate MD pharmacology as per recent competency-based medical education by National Medical Commission. So to proceed the session, it is my proud privilege to introduce Professor Dr. Rani Indra Sinha, who will moderate the session. Madam did her MBBS and MD in Pharmacology and Therapeutics from Patna Medical College and Hospital. Ma'am is currently professor and head of the department of CMCH Patna. Ma'am is honors holder and has been in academics for over more than 33 years. Madam is a member of Ethics Committee of IJMS Patna and also Indira Gandhi Institute of Cardiology. She is board member of Mahavir Arogya Sansthan, a charitable organization. Ma'am is a chairperson of pharmacovigilance of PMCH Patna. She participates as an expert in preparation of essential drug list of the state of Bihar. Ma'am has been a member of selection committee and promotion committee as subject expert in some colleges, and she has chaired several sessions in conferences, judges forum and poster presentations, and actively participated in several workshops. Now I would like to just introduce our next moderator, Professor Dr. Harihar Rishi sir, who is not able to come due to health issue. So we have two distinguished faculty from the IGMS Patna, Professor Dr. Lalit Mohan sir and additional Professor Hitesh Mishra sir, who will moderate the session. Now I would like Professor Dr. Rani Indra Sinha madam to kindly introduce our guest speaker and invite him for his talk. Over to you, ma'am.
Hello. Yes, good morning everyone. I take this opportunity to express my gratitude to the Director of AIMS Patna, to the Dean, to the Superintendent, to the Associate Dean of AIMS Patna and also to Dr. Pramod Manji, to the whole team of Pramod Manji's Pharmacology Department for inviting me to be a part of this event. Today we have a very renowned speaker, Dr. C.M. Kamal, who is the professor and head of a college in Saharanpur, SMNH Government Medical College. He is a very renowned speaker, a renowned pharmacologist, and you will be surprised to know that he is also a very renowned pediatrician. He has an enviable practice of pediatrics in Saharanpur. But what is most remarkable is that he is very passionate about pharmacology, the subject pharmacology. And he has started a movement where he has HODs and pharmacologists from all over the country. The National Pharmacology and Therapeutics, National Association of Pharmacology and Therapeutics. Now, with his zest and with his zeal and with his untiring efforts in a very short span of time, he has started a journal. He has organized a conference which was very successful with more than hundreds of participants, maybe in 500 or so. Yes, and he is seeing that pharmacology reaches the glory. It finds its place in medical education. Sir is also founder of National MD Pharmacology Movement, as I told you. He is the former director and founder Department of Clinical Research, Sharda University Hospital, which is based in Greater Noida. He is founder and head Department of Pharmacology, SMMH Government Medical College, Saharanpur. He represented the country at International Pediatrics Pharmacology Symposium, which was organized by IUPHER. He is the Secretary of Institutional Ethics Committee in his college. He is a certified GCP trainer, he is a certified UG and PG teacher, and he is also a certified trainer in medical education. We have the honor of hearing him on a very relevant topic, which is the assessment of postgraduate MD pharmacology. So over to you, sir, to deliver your talk.
Thank you, madam. Hello. Am I audible? Good morning all. Esteemed dignitaries on the dais and other senior faculty members present in the hall. Without not taking an individual name, I am just quickly starting the session. And it is an honor for me to be here in All India Institute of Medical Sciences and Patna for inviting me for a guest lecture. It is not an honor for me, it is in fact an honor for the pharmacology fraternity. I would like to emphasize that pharmacology, again, that pharmacology is a very, very important subject and very important specialty because it is bridging the gap in pre and paraclinical to clinical sciences, and it is in itself, it is a complete science, it is a complete specialty because in pharmacology we need to study anatomy, physiology, pathology, and we need to understand all the basic things that are related to understanding the mechanism of the drug. So before I can start my lecture, I would like to introduce some aspect of our national movement, and it is as Madam has told that it is not me who is doing all these efforts. It is the collective efforts of all the pharmacologists of the country. So I would like to request all of you to give a big hand to the future of the pharmacology. We have started this movement, NMT Pharmacology movement, to provide a single platform to all the pharmacologists of the country to keep intact our identity. And within a very short span of time, with the blessings of our senior faculty members, senior colleagues all over the country, and with the love and affection, our enthusiastic postgraduate students, other faculty members, we have established and we have crossed several milestones within a very short period of time. And we have registered the organization, we have, with the collective efforts, we have successfully, through NPT, we have organized a NAPTICON. Our president, Dr. Padamja Uday Kumar, and our able leadership and guidance of our General Secretary, Dr. R.K. Dixit, and all the faculty members, our editor-in-chief of our National Journal of Pharmacology and Therapeutics, Dr. Dinesh Padyal, and many others. They are constantly doing hard work behind the scene. And it is the collective efforts of all the pharmacologists that we have reached today at this juncture. Before I am starting my session, I would like to show you a small video that is related to something. Thank you all. Again, I would like to thank the head of the Department of Pharmacology, All India Institute of Medical Sciences, Dr. Pramod Manji, for making constant efforts for making this a reality and making this small event, turning a small event into a grand event. And with the kind support of the dignitaries who are sitting on the dais over here, thank you very much. Now we are starting. Before I can start, I would like to, through MPT, we want to convey sincere gratitude to all pharmacologists who have worked hard and helped shifting pharmacology curriculum towards a more meaningful role. So we would like to discuss the relevance of current NMC guidelines, and we need to give the answer of one question that is again and again coming to the minds of the young generation of the colleagues to our future of pharmacology. Are our MD training programs adequate for the students, satisfying their future career? In this presentation, I will be discussing some historical aspect in the assessment of postgraduate MD pharmacology. We will be discussing some basic principles of assessment for postgraduate MD pharmacology, and we will be discussing what to assess in a postgraduate pharmacology during formative as well as summative assessment, and what we need to assess in postgraduate pharmacology and how we are going to assess our postgraduate pharmacology based on the current NMC recommendations. Again, I would like to emphasize that these recommendations have been recently passed by National Medical Commission by the constant efforts of a team of the doctors who is working behind the scenes. It is also their collective efforts. I would like to pay sincere gratitude to all of them. Thanks to all who have made such a successful and such a very good guidelines so that pharmacology specialty can be turned out to a meaningful specialty in the coming days. If we are going to the history, and Madam is sitting over here, she is having a vast experience in the field of the pharmacology. She will also be able to tell me that this is the shape, this is the thing that were on older days, that MD pharmacologist is being assessed, and a long exercise was given in the form of the dog. They need to assess dog beauty and cardiovascular system and effect of the drugs, and it was really a very cumbersome experiment in itself, and it is very difficult to perform also. And some of the senior pharmacologists, when I have made that conversation through telephonic talk, they have told me that almost the life of a MD pharmacologist was almost tied to the life of the dog, and examiners in the past were so much so strict, so much so cruel that if the dog, some mishappening is happening and dog is dying during the course of the experiment, they are the student is nowhere. They make to fail to the student also. And also these are the instruments, some of the instruments that we have used in the past, and there was only practical viva, grand viva in the form of the exercise and grand viva. I need to say there were the lesser exercises on those days, not much exercises, grand viva and some exercises, long exercise in the form of the experimental animal and the others. Now the current status of the biases that his paper have been published, it is saying that it is published in the 2014 in some journal. It says that 96.6% of their knowledge of the biases, pharmacologists, 96% pharmacologists agreed that the knowledge of the biases they have not used during the past, 10 years of their post-academic careers, whether in the pharmaceutical industry and whether in the academics. So medical sciences is changing on the weekly basis. Again, we have to change, and change is the law of the nature. Those who are refusing to change, they are in trouble. So we have to change. We have already changed. Some of the things have been changed, and some of the things we will be becoming a witness that change will be coming in the future also. So time is also to change in this assessment also. Now before I can go ahead, we will be discussing some of the principal aspects of the assessments. So what is assessment? Assessment is a measurement tool to evaluate the progress in knowledge, skill, behavior and attitude of a student. This is the assessment. So why do we need assessment? What is the basic need of the assessment? It is only that we need to make a fail or pass decision. That is why it is needed. Or simply just we need to give degree, we need to find some job. That is we are assessing. No, there are many reasons of that we are needing an assessment. Evidence that learning is carried out is gathered through the assessment. Evidence that learning objectives have been achieved, it is only possible through the assessment when the assessment process is in place. And student assessment leads to the student motivation. If we are not assessing student, motivation will be lacking among the students. So it is giving a kind of the thrust among the students, motivation to the students that they are becoming a good learner and they are performing good activities. Teaching certification and competency judgment is when we need to pass some judgment related to the certification or related to competency, then we need assessment. Teaching program development and implementations also needs assessment, and assessment is also responsible for the accountability. Otherwise, we will not be able to be accountable for anything. Learning process in itself. So these are the various reasons that is why we are needing assessment. If we are going again to back to the basics, this is the Miller model, where you can see that it is ranging from novice to expert, and there are the domains: knows how, shows, does. In the knows how, it is the fact recall almost, and in the knows how, it is interpretation and applications. Then in the shows, demonstration is lying, and does is the extreme part, where from novice any student is turning into an expert, where he is performing in the practice. I have also mentioned the various method of the assessment that can be correlated to these various hierarchy of the knowledge in the Miller's pyramid. Of course, we can ask fact recall like MC assessment, MCQ assessment, then interpretation, and the application, case presentation and essay can be there. Then it shows how demonstrations are an important part. Demonstrations can be performed either through the simulations method, direct observable skills, and OSCE, observed structure clinical examination, or OSCE, observed structure practical examination. Then direct observation in the workplace based, that is the highest part. So Miller's proposed in a hierarchical model for the assessment of the competence, and it model starts with the assessment of the cognition, and again I have repeated and said already that it is ending with the assessment in behavior in practice. Then professional authenticity increases as we move up from lower to up of the Miller's pyramid. This is just revision of our basics, Miller's pyramid. Now there are two kinds of the assessment. One is the formative assessment, another is the summative assessment. So to understand the best of the formative assessment and the summative assessment, I am just giving you an example. You can see the picture of a chef in a restaurant. Okay. So what he is doing, he is preparing the food, and during preparation of the food, what he is doing, that he is tasting. He is tasting the food, and during the taste process, if he thinks that the salt amount is more, he is adjusting. If there are the more spices, then he is adjusting. Means he is adjusting up to the taste. He is tasting and he is trying to improve. He is not offering this food to the client. So before he is tasting, it is in which category? It is a formative assessment. Okay. Then another assessment is, here you can see the picture of the people enjoying in the restaurant. They are taking the meal. Here they are tasting the final meal. Okay. And then after tasting the final meal, they can make a comment on the quality of the restaurant and the quality of the food of the restaurant. And this kind of the assessment is falling in the category of the summative assessment. So what is the basic difference in the summative assessment and the formative assessment? You can see in the formative assessment, when the cook tastes the soup, it is the formative assessment, where he can make the adjustment according to that. While in the summative assessment, when the customer tastes the meal or soup, then he is making the final judgment. So, in the formative assessment, we are gathering evidences to provide feedback about the learning to the learner and the instructor. While in the summative assessment, we are using evidences of learning to make a judgment. We are giving marks, we are giving ratings, we are giving grades in summative assessment. Process also. So formative assessment can be, and it is having low stakes marks. While in the summative assessment is the final assessment at the completion of the 3 years course of MD Pharmacology. It is for the decision making whether we have to grant the degree, whether we have to make a judgment or verdict that this student can be passed, seems to be a fully expert in the pharmacology, and it is almost a end of the learning process. Not the learning process we can say, because learning process is applicable throughout the life. The person is best to be called a lifelong learner, but the criteria within the domain of the criteria that we have decided, it is the end of that learning process, and it is, again, we all know that we are giving the marks, we are making decisions, so it is giving the higher stakes marks during the formative summative assessment. So what are the various features of the competency-based assessment that National Medical Commissions have given? Competency-based assessment operates within the framework of competencies. Assessment tools should be aligned with the various competencies and the objectives. Competency-based assessment should help to acquire various competencies, various objectives that we have decided already, assessment for learning, and then for certification, as I have already told, that the assessment of learning. And competency-based assessment, if we are comparing it with the traditional assessment method, it is a continuous and ongoing process and opportunities for providing the development of the feedback. It is a direct observation of the student, which is improving the quality of competency-based assessment and the feedback. Then multiple assessors, multiple quality, validity and reliability of the competency-based assessment. Now, the question is arising what to assess. Of course, there are the gaps. You can see from this diagram what are the various domains that is expected from a student. And we are not teaching or we are not giving the training what is expectation from the students. And at the end of during the assessment, we are not able to assess the whole thing that are expected or that have been covered during the teaching and training methods. Okay, it is a small part. Assessment is a small part. So there is a huge gap. So what is then needs to be done? We need to create the kind of the strategies that can explore the maximum amount of what is expected on the part of the student and what have been teaching and training has been given in the Department of Pharmacology to the student. Of course, what to assess, we need to give a thought what is expected from our pharmacology student. Okay, if we can incorporate all those things during the assessment, then it is going to be more meaningful. Okay, these are the various career options after the MD Pharmacology postgraduate. Majority of postgraduate MD Pharmacology want to go medical institution. In the academic, they want to choose academic careers. Of course, pharmaceutical industry is having a very lucrative offers for the MD Pharmacology postgraduates. Lot of options are available in the pharmaceutical industry for the postgraduate MD Pharmacology. Better than before, lot than before. And in the clinical research organizations like contract research organizations like Indian Council of Medical Research, many pharmacologists are working in ICMR also. So there are good job opportunities, there are good career opportunities for the MD postgraduate pharmacology student. In the regulatory bodies, we know very well MD pharmacologist can be a very good asset for the regulatory bodies because during the entire development process, drug development process, a doctor is playing very, very important role. It is the doctor who is being taken as an investigator. He is deciding whether the drug needs to be taken to another trials. All the trial-related documents are going through his hands. So doctor is playing a very, very important part. So in regulatory bodies, doctor can also serve a very good role. Then in pharmacovigilance, many doctors, probably many of your friends, senior colleagues, working already in the pharmacovigilance as a safety physicians. So there are very good opportunities where they are monitoring the adverse drug reactions and safety related programs that are associated to the drugs. After completion of the post-graduation, we cannot say where the destiny is being written. Okay, so some of the students may be coming from a kind of the area where institution is not available, where ICMR is not available, CRO is not available. So we need to prepare our students confident enough. I have already told that pharmacology in itself is a complete branch, complete specialty. It is the only specialty where the paper which is having most of the informations of the patient, prescription. We are teaching the prescription. So best prescription can be prepared by a pharmacologist. So I mean to say there is no harm that students who are willing to take the career as a family physician specialist. Many of my colleagues with the MD degree are doing very well in the practice. So some of them are very good diabetologists. So we need not to keep close any options that are available to us. Okay, we need to keep all the options. We need to make open other options also. More and more options we will be opening. More and more stronger the specialty will become in. Then again, through this video, I am showing the small video which is showing you the various options that are available to the MD Pharmacology postgraduates. We have prepared this video during the NEET PG. You can forward to the other NEET PG aspirants also in your family and friends. These are the various job opportunities. So as such, MD Pharmacology is full of opportunities. So again, give a big hand to the future of the pharmacology. Thank you. So basic principles, again, what to assess. So what has been covered in the curriculum? This is the curriculum that has been revealed by the National Medical Commission. It is having the domains which is divided into 3 parts. Of course, we are quite familiar with all these domains. Domains related to the cognitive part, domains related to the affective part, affective domains, and the psychomotor domain. In the cognitive domains, we are quite well aware of it is containing almost the theory part of the pharmacology. Related to the theory textbook, it is covering the general pharmacology, systemic pharmacology, then related to research areas. In the affective adverse drug reactions are the use of medicines. Then the topic related to the medication adherence. Medication adherence is a very, very big problem among the patients during the follow-up process. What is happening that during the course of the treatment, many patients, they are not able to adhere to the prescribed duration or the prescribed frequency. They are immediately they are getting the symptomatic response, they are stopping the treatment. So again, this is that how effectively we are explaining the medication to the patients. Say for example, if you are taking the example of the asthma, if we are properly explaining the use of the inhaler, which is a part of our teaching and training process, also we are again giving very good training to the our undergraduate how to use the inhaler, how to use the metered dose inhaler. So medication adherence can be improved. Then the various drug interactions. Drug interactions is very, very topic of concerns among the patients also. Then awareness about the generic drugs is a very, very, very hot topic. Our Honorable Prime Minister Narendra Modi ji has given a lot of emphasis on the use of the generic medications, and I feel the entire country is quite well aware by the generic word now, generic drugs, because the generic drug centers are almost existence in every medical institutions, every hospitals or every medical college. Then interactions with the patients, healthcare and professionals, professionals with the other branches. Communication is very, very important aspect of the entire pharmacology. If we are choosing any kind of the career that I have discussed in my past slides, you will agree with me that communication is almost everywhere. Okay, you have to be a very good communicator if you want to become a good teacher. You have to be a very, very good communicator if you want to go to pharmaceutical industry, because so during the whole of the day, lot of communication and more efficient, more powerful in the communication, you are more successful you can be. communication, we need to give training related to the computers and the advanced technology, use of the advanced tech we need to equip, and same thing we need to assess during the assessment also. Then in the psychomotor domains, they have divided it into two parts, depending on the part of the team or interpretations of the result. Two broad categories they have described. I will be giving the details related to that in the coming slides. That mandatory and desirable. I will not be going into details in this slide. Then the writing national prescription and writing prescription analysis and the audit. Then the list of the equipments or use of the equipments related to that. Say for example, anesthesiometer, physiograph in the experimental pharmacology, preparing the drug solutions that we used to do in our practical pharmacology exercises also, presentation in the classroom and in the clinical meetings. Whether you are taking a career in the academia, you have to become a good presenter. And if you are taking in pharmaceutical industry regulatory body, you have to present. So you have to take these into consideration. Same things be taken into consideration during the assessment also. Then determining the EC50, ED50 or PA also a part of the psychomotor domain. Then in the mandatory list they have given the details, which is ADR, casualty assessment, prescription, analysis, audit. Why I am discussing all this? Because I have already told that teaching and training that we are giving, we are having the moral responsibility to assess on those domains. If we are not giving teaching and training, we cannot assess. We should not assess. It is not. It is moral obligation on our part. The kind of the teaching can assess only that. Okay, or that if we are expecting that the student can be efficient in that. Use of the equipments and a gasometer, physiograph, ECG, very important nowadays. Then preparing drug solution, determining EC50, ED50. I already told presentation in the class. Clinical meetings, critical appraisal of a research paper, very important for the pharmacology postgraduate student. And many of we are doing already in the departmental activities also. Preparing the documents related to the clinical trials, whether it is informed consent, whether it is a protocol writing. A student must be well versed with all these. And same things can be taken into consideration when we are making guidelines related to the assessment. Then evaluation of the drug promotion literature, we are quite well aware of. And if we are ourselves aware how to evaluate a drug promotion literature, then in an effective way we can also train or teach our budding doctors, future doctors, that the information they are getting through pharmaceutical industry or clinical representative, they need to be carefully evaluated. Okay, then evaluation of the drug promotion literature is an important part. Preparing the document related to the pharmaceutical industry, packaging, also in that domain. Then clinical pharmacology related exercises are there, which are some of the exercises related to memory, psychomotor domain, some are testing cardiovascular system, some of the exercises may test the respiratory system, say for example of the spirometry or the treadmill. I will be showing you some of the slides related to that during the assessment period also. And exercises related to therapeutic drug monitoring. Many of the drugs like lithium needs to be carefully evaluated in the patient if the patient is already taking antipsychotic treatment for lithium. So lithium as a drug should be continuously monitored, and the various aspects that are related to the therapeutic drug monitoring needs to be well versed in the postgraduate pharmacology student. Then exercises related to the antibiotic stewardship. National Medical Commission has made it mandatory. Some of the posting of the students of the postgraduate pharmacologist needs to be in the clinical wards, probably 7 days posting in the microbiology also, 1 week posting, where they can take a lot of information, or they can be trained, they can be made very much aware of the things related to the antibiotic stewardship. Then preparing documents, SOP related to technique used in pharmacology, research and clinical trial, route of drug administration under the examination methods. Here I would like to emphasize, if we want to test student simply the intramuscular injection, we can upgrade the exercises related to examination to postgraduate students. Say for example, we can introduce drug to be given through peritoneal route. Okay, so same is happening in the clinical branches. So a topic that is being asked in the examination by the undergraduate student is little bit easier. For postgraduate student, topic is of higher domain, like case, good case, but related to birth asphyxia and pediatrics is being given to postgraduate pediatrician or postgraduate pediatric will appearing in the MD pediatrics exam. So same is true with here also. We can upgrade these simulations that is related to the routes of the drug administration. Skills related to the scientific writing are very, very important, and writing skills for the scientific publication, research, project by funding agencies. All these are required on the part of the postgraduate of the pharmacology after they are passing their degree. They are going for the career. So why not taking into consideration during assessment formative assessment of the summative assessment, because formative assessment needs to be in during the entire period of 3 years. Right from the day the student enters in the department to the day that he is taking his degree. Formative assessment is a continuous process, and we are taking the journals, seminars and clubs. Then we need to assess students. We can assess a student on the basis of the grading system also. We can develop grading systems. And these seminars then develop grading systems. And these seminars when assessment, that is formative assessment, it is not making any decision. It is assessment, that is formative assessment, it is not making any decision. It is again most important work or most important importance related to the formative assessment is that it is improving. It is for the improvement. So if a student is making somewhere, we can suggest. In some area we can suggest that this is part, this is the part, we can improve in that. General club, in minimum 1 or 2 weeks is suggested. Topics which include presentation and critical appraisal of audit or original research. Paper published in peer-reviewed index journal. The presenter shall be assessed by faculty and grades recorded in the logbook. And student seminars, minimum of once every 1 or 2 weeks is suggested. Important topics should be selected as per subject requirement and allotted in depth study by a postgraduate student. It is important that a teacher, a particular teacher should be allocated for a seminar separately for each seminar, and that faculty member can work as a faculty moderator to help students to prepare the topic well. We need not to leave entire things to the student itself. We have to be a good facilitator. To be an effective teacher, we have to be a good facilitator. It should aim at comprehensive, evidence-based view of the topic. Students should be graded by the faculty and the peers. Then a student symposium, minimum once every 3 months. A broad topic of significance should be selected, and each part should be led by one postgraduate student. A teacher moderator should again be allocated for each symposium and moderator again that is happening in the previous part. So interdepartmental participation in clinical case presentations is very, very important by the postgraduate students. Student can be take to, if the case presentation is being there in the clinical department, pharmacology student, postgraduate student can go to other department also, and they can also participate after taking the due course of the permission from the other HOD also. And if they are, at least they are observing something, they are learning something. Okay, so this exercise should be given emphasis. Then laboratory work or bedside clinics, minimum once every 1 or 2 weeks can be done in the computer lab. This can be done in the simulation lab I have shown, and this can be directly taking the student to the OPD or the bedside, to the hospital setting, whether best pharmacology teaching can happen. Laboratory work, cleaning, bedside teaching should be coordinated and guided by the faculty members from the department. Then the various methods of the DOPE, demonstrate, observe, assist and perform simulation in skills, lab, case-based discussion, etc. are needs to be used. Faculty from the department should participate in moderating as applicable in another also. This is the DOPE, direct observation of the procedural skill, where a student is explaining the use of the nebulizer to a patient, how it is being used. It is falling in the category, and same can be assessed during the exam also. This is the assessment method, whether she postgraduate student, a simulated patient is sitting by the side over here, she is explaining the various anti-tubercular drugs and the various things that needs to be kept in mind when we are giving, that after taking a particular pink or red, a patient need not be panicked. Of course, anti-tubercular drugs needs to be taken for a particular period of time. After particular period of time, we are switching from the one phase to another phase. All these needs to be explained, and it is through communication. It is possible through communication. A lot of communications are required. Then in table viva. See, table viva is different from the grand viva. You can see the table over here, and this table is equipped with the various drug dosage forms and related to the another contents that are related to the drug promotion literature. You can see there are the instruments, devices used in the drug administration process. So table viva is possible where there is something to be table. It is not like in the older days, only student is sitting and the examiner is sitting, he is asking. See, we are having no right of students asking those questions that can be asked during theory part. Okay. In theory part, we can frame questions why we are conducting practical exam or as making all these exercises. It is because to differentiate it from others. Okay. So we need to be very, very careful. It is the part where most of the teachers are also relating that during the viva also, during the table viva also, they are asking the kind of the questions that can be related to the topic that are related to the theory part. When I am taking the table viva, I would be actually giving the drug. Say for example, solution or the IV infusion of the drug alcohol or the another antipyretic drug. I will give the drug itself into the hand of the student. Whenever a student is taking the drug in his hand, see that feel is entirely different when the viva is being carried out in air. It will give a lot of importance. And since I am a little bit from clinical branch also, you will agree with me that our clinical counterparts, they are taking the examination in our students' life also. We used to say when whenever we are entering in the hall of the exam, it creates a lot of panic because there are so many tables, there are so many chairs, students are, and examiner seems to be well equipped. One is the X-ray, another is the instrument, another is the subjects related to the exams. So they are quite well. So that needs to be developed in the pharmacology department also. That whenever exam is being conducted, it should give a feeling that exam is being conducted like our clinical counterparts are doing lot of efforts. We have to make a lot of efforts. We have to collect all these contents in our department. And while collecting all these contents, we need not dependent on the institutions, financial assistance. We can do some efforts on our parts, which is our moral obligations also. And you will enjoy it a lot. The whole of the process of the assessment, you will enjoy it a lot. Your student will enjoy a lot. Your postgraduate student will enjoy a lot. And pharmacology becomes then very interesting specialty. Then this is the simulated patient where the patient is suffering with the asthma and she is giving a drug related to the asthma. That can be used during the assessment part, or assessment can be done in real hospital setting. We as a pharmacology postgraduate teachers have not touched this aspect. Through National Association of Pharmacology and Therapeutics, we are making constant efforts where our deals will become true, that students or postgraduate students first, they are going to the hospital setting where their viva or their practical examinations can be conducted bedside. Okay, it is a dream for the pharmacologist, but we need to make constant effort to turn this dream into reality. That first, this can be easily done with the postgraduate exam. We are making a lot of modules for past 2.5 years. We are doing constant efforts in the direction. Of course, there are a lot of challenges. It is not that simple because there are a lot of issues also because it needs to be mandatory almost. And postgraduate MD pharmacology exam should be had in advance before clinical and practical examination. Answer book needs to be assessed and evaluated before the commencement of the clinical and practical oral examination. I am giving you a blueprint of the summative assessment as per the recent National Medical Commission guidelines that have been released by National Medical Commission in August last year, which has divided, we are quite well aware of some of the aspects. It is divided in 3 parts. Thesis part related to the theory examination and practical examination. Okay? Because thesis is an integral part of postgraduate pharmacology, and thesis should be submitted at least 6 months before the theory and clinical practical examination. It should be examined by a minimum of 3 examiners, 1 internal and 2 external examiners, who shall not be the examiner for the theory and clinical examination. All these are the various guidelines that are related to the thesis, your thesis. Acceptance of thesis is mandatory to appear for the theory as well as practical or clinical examination. We are quite well aware of this. Thesis needs to be submitted well before the exam and it should be accepted as well. Then in the theory exam, examination of the MD shall be held at the end of the 3 academic years. The examination can be organized basis on the grading or marking system to evaluate knowledge of the postgraduate student, skill of the postgraduate student, and competence of the postgraduate student. Of course, obtaining a minimum of 50% marks in theory as well as practical now mandatory separately for passing the examination as a whole. Then there shall be 4 theory papers. Paper 1 related to basic science applied to the pharmacology, paper 2 related to the systemic pharmacology, paper 3 related to clinical pharmacology, experimentation, research, biostatistics and medical education. last part that you are looking at, that medical education has been recently added. It was lacking in the previous curriculum. Now it has been made mandatory by every postgraduate student that they should be well aware of the medical education aspect also. And in paper 4, recent advances in the pharmacology. This is related to theory part. Practical or clinical examination in the examination we are already performing or doing already in the 2 separate, it should be spread of 2 days of the work, including major component of the syllabus focusing mainly on the psychomotor domains. Of course, the other domains needs to be tested during the pro-practical examination. This slide will be giving the current status of the animal experimentation. That is related that animal experimentations are now desirable but not mandatory. If they need to be performed, animal experiment, they need to be compliant with the regulatory bodies, regulation of the government of the India, notified from time to time. Amphibian, dog, cat experiments can be conducted by computer-assisted simulation models or facilities on the computers, where the facilities are available, or if the facilities are not available, that can be procured. So I mean to say that it is not mandatory for the postgraduate exam student to perform an animal experiment as such. If he is interested, she is interested, of course, that things can be taken into consideration. How it can be made possible, I will ask the exercises. Of course, grand is existing right from the beginning. Okay, so we can take the list of the long exercises that are available on our disposal, and we can take one long exercise, 2 short exercises. Then they have suggested OSCE and OSCE related exercises. OSCE and OSCE related exercises, I will be giving the details. Then, of course, grand drama and presentation. Now, in the coming slides, I will be going into the details one by one of each aspect. Coming to the long exercise, we would like to suggest, because many of students would be going to the industry, protocol designing as a long exercise can be given. And same is true, same is my suggestion also because of protocol writing and protocol designing is an important part for the research paper and through the human research also. If we are giving only topic related to the clinical things, there are 2 things. Topic related to the main MD pharmacology on its thesis is best, and then additional research topic can be separated. If a student want to take that into animal experimentation, that can also be considered, of course. So that will give the advantage that the student will be exposed to both aspects, as animal experimentation also, as well as to the human experimentation also. That is the are expected from the MD pharmacology. Of course, a case audit in detail can be performed during the exam. Then we can perform an experiment or simulated experiment. These simulated experiments are as per the regulations. This can be, as I have shown here, the cardiovascular effect of the particular drug of the cardiovascular system. Patient can be put on the brain wheel, and that can be given as a long exercise. It is clinical related, and it will help you if you are want to choose a career in the industry or clinical research area also. If you are interested in the animal experimentation, that animal experiment can be performed with the help of the software also. Among all these long exercises, one long exercise can be chosen. Now I am coming to the short exercise. So 2 short exercises needs to be given to the students. Here you can see I have taken one exercise, that dilatation of the pupil with the tropicamide. See, this is the real exercise that we are doing in our ophthalmology department. Our ophthalmology colleague, and it is dilating, and students can be given a simulated patient where we can give the pupillometer, we can studying, and it is showing the pharmacodynamic effect of the drug directly. It is related, that exercise related to the pharmacodynamic effect of the drug to the actual, to the patient itself. So demonstration of the effect of the drug, interpretation of the result can also be done. Similar exercise related to the rabbit, we are quite well aware of. Demonstration of the effect of the drug, interpretation of the result. In small animal, animal optional are available in this software also. And those students who are very, very enthusiastic about the animal experimentation, in animal holding area, a rabbit can be procured for that particular day. We can perform all these exercises, and that rabbit can be safely returned to that agency. In the interpretation of the result of the previous tracing, here I have shown the tracing related to the guinea pig idiom. Here, the interpretations of the result obtained from the spirometry, I have taken from the real world, real students situation. Then ECG can show a lot of difference. QTC prolongation can be easily seen, effect of the drug in the ECG. And then of course, dog BP can be seen, or that can be performed again by the So OSCE exercises, 10 to 15 stations have been suggested by National Medical Commission. My opinion is that if we are giving 5 minutes for a particular OSCE exercises are very much challenging, because it needs a lot of planning in the department. All the faculty members should get involved in preparation of the OSCE and OSCE related exercises. It requires a blueprint to be performed. It needs various things that needs to be procured before OSCE and OSCE exercises can be taken into consideration in the exam. It needs a lot of efforts also, a lot of determination also. 10 to 15 stations have been suggested. My personal suggestion is that if we can take 8 or 10 or lesser than 8, that can also suffice. We can increase the time. If we are giving 5 minutes to an undergraduate student, in my opinion, postgraduate students can be given 10 minutes for a particular OSCE and OSCE exercise. And we can elaborate that exercise also. A station should be a mixture of observer present and unobserved presentation. I have taken a separate session on OSCE and OSCE exercises. I will not be going into the details because it is again regarded separate session for that. We will consider some other day. But these are the exercises that National Medical Commission have suggested last year during the August document. These are the various exercises, various drug delivery system, drug dosage form, calculation of the pharmacokinetic parameters, then pharmaceutical calculations, then statistical exercises can be given during OSCE and OSCE. We can give pharmacoeconomics related exercises, critical appraisal of published paper, pharmacology and research related article, abstract writing of published paper, evaluation of the drug promotional literature, adverse drug reaction reporting and causality assessment, assessment of preclinical toxicity data, LD50, ED50 calculation, analysis of the rational and irrational formulations, then selecting a P drug, writing the rational prescription, analytic instruments, use and interpretation of the flame photometer, UV spectrophotometer, ECG, QT interval prolongation, spirometry, spirometry reports, constructive and obstructive, identifying the ethics related dilemmas, or mistakes in clinical document and checklist for the ethics committee. So this is I am showing here you the examination circuit. Examination is a station circuit over in this slide. You can see that here there are the students is entering from one place, and this is the responsive station. This is again responsive station. This is the mixture of the station. This is the procedure station. Again, in between a rest station can be given, so that whatever things have been left, student can correct it. It can be given separately 5 minutes for the rest station also. Then student is coming to the again response station. Communication exercise can be performed in the OSCE and OSCE, then again response station, then rest station. So you can see that on the two tables, we need observer or we need examination, and on the rest can be evaluated later on. So it is not that if we are making an arrangement of the 8 tables, we need to arrange 8 examiners, which is not possible, obviously. So it is a mixture of the and it should be clearly marked in logical sequence that transit from one station to the next station. So student is entering from one side in the hall and then he is exiting after the related exercises. Of course, grand viva perfectly by each examiner separately. Oral or viva examination on defined areas should be conducted by each examination separately. It should be comprehensive enough to test postgraduate student overall knowledge. Focusing sharply on the psychomotor and affective domain. Then, of course, we are giving a micro teaching or presentation skill where thesis presentation is there. So, in this, we can give a small topic related to the undergraduate teaching. We can give a question paper or small question paper set, because if we are thinking our students are going to be future teachers, we need to equip them with all these exercises, and these can be assessed during the examination also. And we can give the designing learning objective related to the medical education. Then, of course, we all are performing discussion on thesis, that is called thesis presentation in our department. While giving the presentation, we need not only assess the content of the topic. Okay, you are getting my point? As an assessor, I need to assess the entire thing. I need to assess the capability of a student making a very good PowerPoint presentation also. See, if I am making a PowerPoint presentation which is not having so much information, not images, not multiple, it will the entire the discussion and entire session will become very, very boring. Okay, and many of your faculty members will go asleep. So we need to make interesting. We need to test the students' capabilities of making a good presentation. It also including the minute details, which font to be selected, which color to be used. You have seen most of the color of my slides are white. Why? Why? Because it is a clear presentation of the topic. Another important thing is, if I am converting entire of my PowerPoint presentation into PDF format and then I am getting it Xerox, if it will be having white background, it will not take lot of ink. It can be easily circulated. You can give also to your other in the form of the hard copy also. And that is not possible if we are making a lot of color. See, if I am putting the background blue, it will take quite absurd. So we need to test all these knowledge during the assessment part also. How the presentation skills are with the postgraduate student. Now we can say confidently, I am going to the end of the session, that we are heading towards a more realistic roles of doctor with pharmacology, specialty. With these NMC guidelines in its place, and of course we are continuously working bench to bedside, where students can be taken to the actual wards where examination, practical pharmacology can be performed. There, so in summary, I can say with confidence that the assessment of postgraduate is an integral part of postgraduate teaching, and it is mandatory for the award of MD pharmacology degree. We have already divided the assessment into formative and summative. Formative assessment should be continual and should be assess all medical knowledge, patient care, procedural skills, interpersonal skills, professionalism, self-directed learning, multiple assessment improve. Entire my presentation is based on this document, revised guidelines for the competency-based medical pharmacology that they have released in the August last year. This is also available on the website of the National Medical Commission. Of course, I have added some of the material related to that, making it more interesting through the pictures and explanations through the various examples that I have used. I would like to have acknowledgement to the Executive Director of the All India Institute of Medical Sciences, my very good friend, very close friend, Dr. Pramod Maji, who is making continuous efforts. Thank you very much, sir, for inviting, for giving me an opportunity to speak over here. It is really an honor. I'm pretty excited on your invitation. Thank you very much. And you have made such a nice arrangement of attending this national event. I am thankful to our principal of our government medical college, who is always a continuous support behind me, providing all the related things that are needed in my department. Dr. Padanjali Kumar, who is president, R.K. Dixit, General Secretary Sir Dr. Dinesh Bagyal sir, Gurdas Tilnani sir, former director, Dr. Chaitanya Desai from Ahmedabad, Sukanta Singh from IK Institute, Kolkata. With these words, I am ending my sessions. And from the bottom of my heart, I would like to thank you to all of you for being awake almost all the time and listening very carefully to the topic. Thank you very much.
Thank you, Dr. Kamal sir. You have covered very comprehensively all the salient aspects of MD pharmacology curriculum and the assessment process. You rightly mentioned that one of the assessment process should be of making a question paper or formulating questions. So now the house is open for question and discussion. Anybody who has any question?
Yes.
Hello. Excellent deliberation, sir. Excellent presentation. Thank you for making so many of our concepts clear. Just one question, since you ended beautifully by saying that eventually we want our postgraduate students, those who are doing MD pharmacology, to become, although they have a variety of career options, but at the end of the day we want them to become good teachers. So while we are changing the assessment pattern, the way we assess them, we have made so many changes to the cognitive domain and psychomotor domain, and in several ways we are trying to connect ourselves to the clinical side and making our discipline so much more relevant. But at the end of the day, we want to be good medical teachers. And as was evident through your presentation, a lot of the concepts that were mentioned, for example, dogs, for example, simulated patients, for example, OSCE. Personally, for me, it is only in the last 2 years that I was exposed to these topics. And I feel now that it was a struggle for us as medical educators to be more relevant, more innovative. Now since we are changing the way we are teaching our postgraduate students, I feel that maybe should not more of medical education topics be incorporated into the curriculum of MD pharmacology also. Because although when we are assessing them in that manner, we are trying to expose them to these topics. But maybe we can have a little more of more of such newer teaching learning methods in the way and actually teach them, because the moment they go out, they are supposed to be
included in some during the result or not, like MBBS, we have the still formative assessment that is included. In the MD pharmacology, it is included here now.
So we have formative assessment in the form of theory examination, and
That is included in final result only.
yes, we have 40 and 60% ratios. 40% come from internal assessment, or you may say this is a formative assessment, and summative annual professional exam 60%. So 40 and 60 ratio is here for
In MD pharmacology also.
And for UG we have 20 and 80 ratio.
So that is one of the difference from the MMC or AIMS. But I felt it is a AIMS is doing more better in terms, because if you are not include formative assessment in final result publication, they are not too worried about that. And formative assessment is a day-to-day assessment. Another thing, sir, I am little bit different from point of view. We are now more focused toward the clinical research and protocol examinings, all these clinical materials. But whatever in India, we have huge number of population. We have the older times experimental pharmacology. We are showing the dog experiment or whatever. Later on it is a banned or so many things happen. But drug development process is still in India is not in a good shape. So because we have the producing MD pharmacology student, they are going to academy because large number of medical colleges is going to open. They are more lucrative. But we have to produce basic scientists also in terms of pharmacologists. That is our lacking in the terms of new curriculum. So I am not as in terms of decision or thing, but okay. Still experimental pharmacology has role, because we have to produce, we have to make the basic scientists also.
So we have not denied the role of the experimental pharmacology as such during the postgraduate context. But thing is that because of the certain limitations related to the animal experimentation and because of the more things, you will agree with me that we are not able to make a good relation with our clinical counterparts. We are not well connected. If we try to get more involved with our clinical parts, those faculty members who are working in clinical, then there are a lot of things, lot of fields that have been left untouched, because there are two things. One is drug information services, another is the prescription audit. You will agree with me, prescription audit is little bit disputed things because you are directly interfering with the clinician's decisions also. But drug information services is very important, very interesting thing, where we have tried at our institutions. A number can be activated for 24 hours. A postgraduate or faculty members can be given in charge of for that particular day on that he is on duty. Okay, like in clinical. And any faculty members, any postgraduate quite hectic setups, very busy in the setups where the schedule is very, very busy. Some of them may find it very difficult to find a drug that needs to be given to a 6-month-old child who is suffering with diarrhea or something else related to asthma. He may be needed that particular dose at 10 o'clock in the night. So if we can give that service through pharmacology department, our relation will become more collaborative and pharmacology will become more meaningful. So many areas need to be explored. Apart, of course, pharmacology and experimental pharmacology is one of them. I am not denying that.
Our institute have already trying to censor the post regarding from the government to implement in future. It is a very good idea to open the drug information center. As well as you have given one more good idea, what like diabetologist. Okay, we have the instead of posting 1 week in so many departments, we have to even our HOD is implemented like that. He is asking about that your area of interest. So he is posting like 1 month in like secretary. Depend upon the student interest. Thank you, sir. You have very well presentation.
Any other question?
We also have permission of drug and poison information center separately.
Yes.
So AIMS Patna is just now starting drug information center. We have in the process of taking the software for this to run this center.
Very good. I would like to have some questions from our post-graduate because they are the future of the pharmacology. Please open up with any kind of the question that you are having in your mind. It could be absent. And if I am unable to find, give an answer in this session, most of you probably, are you connected through our WhatsApp? Are you connected? How many students are connected on our WhatsApp? Please raise your hands. So many of the students are already connected, and I would like to request to other students also, if they are not having the links, I can forward the links today itself after this session. You can immediately join. With joining with this WhatsApp group, you will be directly connected. See, more than 1500 postgraduate students have already now connected, and I am not aware the Kashmiri student is connected to the Kanyakumari. And Arunachal to the Gujarat. It is a wonderful opportunity also to interact also. And furthermore, you are getting a lot of updates related to important updates that are related to the pharmacology and therapeutic. So if you are not a member, it is free. You can find a link. I can send. Only we to the MD pharmacology students we are giving the permission, and you can join and you can. If I am unable to give the answer in this session, you can ask freely. I am available 24 on this session in the WhatsApp also. You can directly call me and please speak out your questions, absent question also.
As the goal of the CME is to make the student competent in every aspect they are expected. So I think that clinical research done in hospitals are very much different from the clinical trials on the new drugs, and after doing academic clinical trials or clinical research that are common in hospital, the students are not competent as investigators in the clinical trials of the new drugs. So Department of Pharmacology in collaboration with NCRO can arrange student posting of 15 days or 1 month in the CRO, so that student can have experience.
They have made a provision that the students those who are willing to take up a career in the clinical research or pharmaceutical industry, they can pass certain period of time to a particular CRO. But there are certain challenges also, practical challenges, that your head of the department needs to be make some relations with that CRO. That then it is possible. Otherwise, in the passage of time, see through the organization level, because we are now trying to connect more and more pharmacologists, your own colleagues, senior colleagues, and the pharmacology who are working in clinical research organizations or pharmaceutical industry. We are also trying to making them or stand on this single platform entity. So through that, in the coming days, we are quite futuristic and optimistic. Your suggestions will be well taken in the coming days. Thank you.
Thanks, sir.
Sir, you told that there are a lot of scopes after MD Pharmacology, but still there are very hesitation in choosing the MD Pharmacology. What can we do for removing this hesitation, sir?
I have already given an example. See, if more and more avenues you are taking, opening for the postgraduate MD pharmacology, more and more students will be attracted towards. I already told by our giant of the pharmacology, Dr. K.D. Tripathi career. I have seen pharmacologists, those, I see myself is a pediatrician also, but I am more inclined. It is the person who is sitting in your heart, who will be proving in the passage of time. It is not the branch, it is the person that is important. You yourself with your efforts will make your branch more stronger. Coming days, future, you will prove to the world, to the country.
Thank you, sir.
Sir, hello. Sir, thank the Dr. Pramod for calling us from the Department of Pharmacology, Patna. And really am I audible there? So, एक सर बंगाल में प्रोवर्ब है बिंदु में सिंधु, वो आपका प्रेजेंटेशन वही था बिंदु में सिंधु, तो पूरा प्रेजेंटेशन में यू टोल्ड अ लॉट दे एंड आपने अपना नाम को सार्थक किया, कमाल। वन इम्पॉर्टेंट एस्पेक्ट आई वांट टू discuss or you can give your opinion there regarding the self-directed learning, because the MD is not the spoon feeding. We are every time we are not. They are not like that. Yes, they are very very different. So, what is the opinion or what is the current recommendation regarding the self-directed learning there? And then second is the research. Very two questions are there. Second is the research. So, because many times they are coming, sir, आप announce करिए topic. तो BCPR भी करना है और रिसर्च में भी जाना है, तो इन दो पे एम्फेसिस शायद ज़्यादा होना चाहिए।
So BCPR is already mandatory for the postgraduate student. It is mandatory for the promotion aspect also. And as you have told that self-directed learning, I have given a separate session on that. That is available on the YouTube also. That self-directed learning is applicable everywhere and in almost every day. If I am taking an example of making a good presentation, see, it cannot happen that somebody will be able to make me learn making good presentation. It is me who, with the passage of time, through the computer, through the servers, or using the server or near the computer, over the computer, by itself. I was not, you will probably will not believe that the first day, I have purchased my laptop. I was not even able to open it. How to open it? My wife, she has to speak on that. यहाँ से open होता है. So on the day I am here. So it is through the self-directed learning, and integral research is an integral part of pharmacology. It is applicable everywhere, and we are fortunate as compared to before, where the madam probably it hats off to these faculty, senior faculty members. How much efforts they have done in the past, that these things were not available in the black and white, otherwise they are much more talented than us. See, to us, they are available in clinical whites, in black and white. We are following, we are doing. Maybe if these were available to them, they could have done magic to them. But now we are living in an era where the things are much more futuristic, much more realistic. We can take a lot of advantage to that. We can take a lot of advantage to the tech. We can take a lot of advantage to the computers every day, almost every day. We need to train our students to use of the various apps that are available for direct dosage calculation, for dosage. Why not we have this pharmacology? We need to introduce, we need to take advantage of the tech also, or computers also, smartphones also. We need to utilize each and everything.
Sir, there is one question from me also. Would you please throw some light on the district residency program? Do we have to assess that also?
District residency program has been recently been introduced, and they have told that because it is first year probably where district residents, we are sending the district residents. So we need to make some collaboration with the district authorities also. Some of the faculty members were telling that students should be given opportunity, but during the district residency program, it is suggested by the National Medical Commission also that our postgraduate students should not be utilized as a human resources there. That they are sending them to collect the reports or to writing the report. They are having separate goals, and they needs to be inclined to those kind of goals that are predefined. And during the district residency program, that can be taken well of during the implementation. Of course, because this is the first year, there will be lot of teething problems because of the introduction of the program. But with the smooth application of this district residency program, I feel at least it is a good opportunity. And it is, you will agree with me, it is an official opportunity. There are two different things where post head of the department, enthusiastic head of the department, like in sitting or many medical institutions who will agree of sending the students to the clinical bar. But now it is mandatory and it is giving in the guidelines, it is a good opportunity. And it is again giving a lot of exposure to our postgraduate students to go to make understand, and Government of India have also made suggestions. We have ourselves witnessed it through COVID what have happened. Probably you will agree with me, many of our faculty members and the pharmacologists, they have done duty in the COVID wards. How many of you have done duty in the COVID wards? See, they are postgraduate and the pharmacology, they have done their duty in the COVID wards. So in case of the emergency, we have to be prepared all the time. We cannot deny that we are pharmacologists and cannot test patients. We have to well versed with the patients also and our subjects also. Thank you.
Thank you, sir. Sir has dealt with the MD pharmacology curriculum as well as the assessment process in great detail. What I have come to understand is that earlier pharmacology teaching was about gaining knowledge, but now it is more about competencies and how we put that knowledge into practice in real world scenario. Assessment is a very important part of any education process, and assessment should be continuous. It should aim to motivate the student, to make the student accountable. Assessment will be not only about the cognitive domain but also the affective domain and the psychomotor domain. And one thing which he said very rightly is assessment, which is formative assessment, is for learning, that is, it promotes learning. And summative assessment is of learning, that is, it is overall assessment of how much you have learned. So with these words, we come to the end of the program. I hand over the mic to Nishi.
With the permission of moderators and sir, we have another question. May we take that question, ma'am?
Yes, I'm sorry. You can take the question.
Hello, sir. Hello, ma'am. I have just joined MD. So, myself, Dr. Charmi Prakash, IJMS Patna.
You are connected to our WhatsApp group. I will be sending you the link. You can join. Okay. So again, I am emphasizing that if any question is there that is not covered, you can ask there also. Please continue.
Sir, I have a small confusion. It may be funny too. Sir, I was thinking that I will be master of pharmacology, medicines, all medicines, it's all aspects, just as mechanism of action, interaction, side effects, use it. But I'm after joining, I'm seeing inclination of all of my colleagues towards research. It may be statistics मतलब we are completely unknown to that माहौल. तो सर ये जो मुझे मास्टर होना था मेडिसिन में, तो सर वो क्या पॉसिबल 3 साल में हो पाएगा? क्योंकि ये हम लोग तो उसमें भी तो ये रिसर्च वगैरह भी करना है.
All the domains are open now. I have already told so many career options also. But you cannot expect that the knowledge, experience of a 16 years of pharmacologist with the 3 years of the pharmacology. With the passage of time, you will be exposed. And learning is a continuous process. And for a doctor, the best person is who is lifelong learner. We have to be lifelong learner. We have to be prepared. Even at my stage also, I feel that I am in the learning phase. With day to day, I learn a lot of things. And see, your other colleagues also can be your teachers also. The things that they are already knowing, the skills that they are already knowing, we are learning from others also. So learning is a continuous process, and in my opinion, it should be a lifelong process.
सर मे बी कि आगे जाकर ये कंफ्यूजन क्लियर हो जाए. When I was involved in teaching.
All your confusion will be clear. There is no
Okay,
doubt
sir.
about
Okay, sir.
Thank you, sir, for enlightening us and making us understand the recent guidelines of CBME curriculum. Now we have our Dean Academics, sir, on the dais. So I'd like to call Dean, sir, on the dais and say a few words on this occasion.
Namaskar, Dr. Kamal, Dr. Rani, Dr. Mary, Dr. Ritesh. Thank you for coming here, and it is our honor to see you here and in this academic forum. And I was not present because I was doing another research in OT when I was getting the call to come here. We have got a call for do narco analysis of the patient, not patient, some person. So I wanted to do it in a normal person in thiopent and how much they answer. And today I combine that with this also, that how much conscious level is present when he is answering question. So sorry for the delay, but I heard that your talk was very good. And in medical education also, here in AIMS Patna, we have started the new curriculum of NMC from 2020 batch. And all the modules, including the foundation and the elective posting will be done, and it is rightly a competency based course. And as you talk that it should also be involved in the MD curriculum. In our anesthesia we are already doing OSCE in our regular exam, and I was worked about 10 years in BP Koraila Dharan, where it was from the beginning in 1990 the integrated system of curriculum was there, and OSPI and OSCE was the normal process of assessment. But yes, it is a very good modality of assessment, and almost all the departments like pharmacology, anatomy, physiology, because that tests more of the psychomotor skill as well as the other domains. And as you already during discussion told that during COVID also, the COVID was for the mankind, and treating physicians were not divided into, in our hospital, there were only 2 types of doctors. One who were doing active duty in COVID, from anatomy to medicine, surgery, obstetrics, everyone, and others who were doing planning for the COVID, how to do that. So in that there was no other specialists. They all were specialists of COVID, and they were doing the, and we saw that progress also. There was a time of plasma, then there was a time of tocilizumab and others. Ultimately, when we understood the pathophysiology of that virus, we came to know nothing is there. Only two drugs are important, that is enoxaparin and corticosteroid, which is important. So वायरस तो मार करके निकल जा रहा है, उसके जो गड़बड़ हो जा रहा है हमारे बॉडी को पहचानने में, that is the missed identity. There the anti-inflammatory and anti-clotting factor drugs are only. But yes, we all saw that process when one vial of tocilizumab was sought and sold in even 50,000 and lakhs. That's how our mankind is growing, and I thank Dr. I will invite you to please consider us AIMS Patna also like multi-centric some research or trials, or you want to do some more academic activity, because we have got our hall and other infrastructure which is ready available to us for things. Please utilize this and take advantage of our ever enthusiastic members, faculty and postgraduate students of Pharmacology department. Thank you very much, Dr. Kamal, for giving this beautiful topic and discussing here. Thank you.
Now I request Dr. Pramod sir to present our gratitude in the form of sapling to our Dean sir. Now I request our Dean sir to felicitate Dr. C.M. Kamal sir. Now I request our faculty to felicitate Dr. Rani Indra ma'am. I request our faculty to felicitate Dr. Harya Dikshit sir. On behalf of Dikshit sir, I would like to call Dr. Lalit Mohan sir and Dr. Ritesh Mishra sir. I request our faculty to felicitate Dean sir.
Thank you, Mr. for your encouraging words.
I request our department to present a token of appreciation to Dr. C.M. Kamal sir.
एक ग्रुप फोटो लगाइए तो ये सब कुछ लगाइए
चलो आप लोग सब ग्रुप फोटो सारे लोग आ जाइए, थोड़ा और आगे आ जाइए.
To be with you all because you are the future of pharmacology. Thank you for joining us.
यहाँ पे खड़ा हो जाओ, एक रो इधर, एक दो रो.
And acknowledge the lecture possible. I heartfully thank our director sir for his constant guidance and support. But first and foremost, I would like to thank all the participants here. As teachers, as medical educators, it is our dream to have our audience, to have participants who are so receptive and who are ready to discuss. Thanks for the discussion and thanks for the patience of hearing. Thanks to all the participants from all the colleges of the state. My heartfelt thanks to our guest speaker, Dr. C.M. Kamal sir. More than his talk, of course his talk was extremely relevant and the need of the hour. But what I truly thank him for is that we have been able to witness as faculty and as postgraduate residents. I would just like to mention to you that if you don't know, he is someone who is truly dedicated towards spreading knowledge. His determination for making CPME the norm, something that we were not able to implement or even understand for quite some time. And his passion for taking the discipline of pharmacology to great heights. It is truly exemplary. Thank you, sir. Thank you for being a constant source of inspiration for us. Thank you for taking out your precious time to enlighten us and enabling us to learn from you every day. We have been trying, sir, in our own ways to implement these complex topics, but here on forward, hopefully we'll be able to execute it much better. I thank Ranindra ma'am for being a constant support to us, and with her gracious presence and hard work, she elevates any program that she is a part of. Thank you ma'am, thank you so much. I thank Dr. Lalit Mohan sir and Dr. Hitesh Mishra for being here and being a constant support partner for us. Thank you sir. This program was much enriched by your presence. We are sorry that Dikshit sir was not able to be a part of this program today, but we remember him and we are constantly enabled by his support. I thank our Dean sir, Dr. Badani sir, who is a constant source of motivation and enlightenment for us. Sir is there to help us in any capacity all the time. Thank you sir. Thank you so much for taking out the time and being here. I thank my department. At AIIMS Patna, we are blessed to have an excellent team. A team that is ready to learn, absorb, execute and perform any task that they are handled. Dr. Pramod, our head of department, Dr. Vikas Banerjee, Dr. Rakesh, Dr. Sunil, everyone and all of us are enriched by all our presence. All my residents, Pallavi, Dr. Keshav, Dr. Akhilesh, our postgraduate students, Nishi, Neha, Abhishek, Shubhashri. We might scold you, but trust us that nothing in the department is possible without your support. Thank you so much. I thank the department staff, Naveen, Chandan, Dharmender, N.K. Singh. These are the buttresses upon which the entire department rests. Thank you all. Thank you so much. I thank the auditorium staff. They have made this setup so easily available and accessible to us. Everything has become very easy. But one very important organization that I forgot to thank was the National Association of Pharmacology and Therapeutics. When you are part of an organization, you need to feel involved. That is the main reason to become a part of a group, right? You want to feel involved and uplifted. You want to feel acknowledged and supported and authenticated in every way possible. We as members of National Association of Pharmacology and Therapeutics have all that and more. Thank you so much. We thank the organization for providing us with support, knowledge, and most importantly, a way forward. Thank you so much. And thank you for being here. Participants are requested to kindly take their certificates, and there is high tea for them, and I request our faculty. So we proceed for lunch. Thank you so much. I request our Dean sir to give us the certificates, sir, please. Since you are here with your gracious presence, we should be benefited. Thank you, sir. I request our Dean sir to present certificate of participation to our HOD sir.
वो भी बात में है दूसरे नीचे से शुरू करो नीचे से शुरू
Dr. Shruti ma'am. Dr. Vikas Maharshi sir. Dr. Rajesh sir. Dr. Sunil sir. Dr. Rana sir. Dr. Pallavi ma'am. Neha. Dr. Subhashri. Dr. Abhishek. Dr. Nitish. Mr. Shiva. Mr. Naveen Kumar. Mr. N.K. Singh. Mr. Dharmender Kumar. Mr. Chandan. Thank you, sir.
Mm-hmm.